Timmins, James Bay.
Thank you, Mr. Speaker. We have a government that is willing to spend $80,000 to $90,000 a year incarcerating prisoners. We see that they spent over $100 million already on trying to stop drugs getting into prison, and it's failed. The problem is a lack of vision in terms of how to deal with the serious issue of drugs that are affecting our communities. In the city of Timmins, we've set up a fentanyl task force to deal with the heavy impacts that the abuse of fentanyl is having. And one of the key things that's come forward is the need to be able to track the fentanyl patches. So these are opioid patches. My colleague is a nurse. She will know very well about fentanyl. But without a barcode or a serial number that would be put on by Health Canada, the police are unable to track the source of the patches. So if we're having patches of 100 coming into the city of Timmins, these are very lucrative for gangs. But we need to be able to do the preventative approach to be able to stop this kind of heavy-duty opiate being brought into our communities and then affecting people who may not have otherwise ever gotten into drugs. I know certainly some wonderful young people who've been affected by fentanyl, people who've died from it, people who had their lives ahead of them. So I'd like to ask my honourable colleague what she thinks about the need for these coherent, grassroots, preventative approaches to prevent these kind of drugs, number one, from coming into our communities and keeping people from getting involved in the drug trade, and also being able to stop by going after the gangs who are trading in these fentanyl patches.